Hi, this is Dr. Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. The question I get asked all the time is, what is it like living with heart failure? Congestive heart failure is a serious disorder, but we have amazing treatments for congestive heart failure. Most times we can render people virtually symptom-free and dramatically reduce their risk of death by applying some principles and treatments that are the standard of care now. Most people would think that means they have a weak heart, they can't pump out the blood. But actually only 50% or so of people with congestive heart failure have a weak heart. Diastolic dysfunction means it's a stiff heart. So in order for the heart to pump blood effectively, it has to relax and fill with blood. So when somebody has a weak heart, the heart doesn't squeeze properly. When somebody has diastolic dysfunction, the heart doesn't relax properly. Diastolic dysfunction is typically more common in females. It's more common in people with high blood pressure, who are overweight, or who have diabetes. So the treatment would be to treat those underlying risk factors, and you can make dramatic improvement in somebody's symptoms with diastolic dysfunction by taking the proper blood pressure medications, diuretics, and all. Congestive heart failure from a weak heart, or somebody who's had long-standing, poorly controlled high blood pressure, thyroid abnormalities can cause this, valvular abnormalities can cause this, viral cardiomyopathy. Now that's a heart that's weak. So you have to find the underlying reason for that, and you have to treat it. And then you have to use a standard protocol using 3 different families of drugs together in order to prevent the heart function from getting worse and also to prevent fluid backup. So the treatments of cardiomyopathy depend upon the type of cardiomyopathy somebody has, or congestive heart failure. We can render most people symptom-free or mostly symptom-free, and included in the regimen that we always like to recommend is cardiac rehabilitation, which is a gradual cardiac training program to improve exercise tolerance, because we know exercise tolerance is one of the best predictors of survival in people with heart disease. So this is Dr. Rick Pumill from Cross County Cardiology, and thank you for listening in on congestive heart failure and living with the disease.